Hello, welcome to another episode of Arthritis and You, a Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Ever wish you had a little more time to connect with your doctor? Really get into the nitty-gritty, especially when you're dealing with a chronic condition.
It's tough, right?
It really is. And that's exactly why this research article, Patient Satisfaction with Pharmacist-Led Collaborative Follow-Up Care in an Ambulatory Rheumatology Clinic, caught my eye.
Yeah, that's a good one. It really makes you think about how we manage chronic conditions. I mean, what if it wasn't just about popping pills and hoping for the best?
What if it was about having a whole team in your corner?
Exactly.
And that's what this study's all about. They wanted to see what happens when a pharmacist, someone who's an expert in medications, joins the care team working directly with patients.
And that's huge, especially these days when so many people are dealing with these complex chronic illnesses, like rheumatoid arthritis, for example.
Definitely. And we all know what it's like to navigate those waters. It can be so overwhelming.
It can be. So to have someone who really understands medications, who can explain things clearly and answer all those questions, it can make all the difference.
It's like having a guide, right? Someone to walk you through the ins and outs of your treatment plan.
Precisely. And that's what they were going for in this study. Comparing the traditional model, where it's primarily the rheumatologist interacting with the patient, to this collaborative approach where the pharmacist has a more active role.
And it wasn't about replacing the doctor or anything like that.
Right. No, not at all.
More like adding a new layer of support.
Exactly. It was all about seeing how this collaboration, this team-based approach, could impact how satisfied patients were with their care.
And, spoiler alert, it made a big difference. But it goes beyond just satisfaction. This model has some really interesting implications for the future of healthcare. So they found that patients were more satisfied, which is great. But how much more are we talking? Like, was it a night and day difference or just kind of a nudge in the right direction?
It was a significant difference, actually. And the cool thing is they didn't just measure overall satisfaction. They actually dug deeper.
Oh, wow. How so?
Well, they looked at 6 different aspects of satisfaction, like how satisfied were patients overall? How well did the providers explain things? Was there a sense of empathy? Did the care itself seem technically sound? How were the attitudes of the providers? And lastly, was there good communication overall?
Wow, so they really covered all the bases. Makes sense, though, with a complex condition like rheumatoid arthritis, you got to look at the whole picture. But I'm curious, out of all those areas, was there one where this collaborative model really stood out?
Definitely. The collaborative model scored way higher in giving information and empathy, which makes a lot of sense when you think about it.
See, that's interesting because when I think pharmacist, empathy isn't always the first thing that comes to mind. No offense to all the amazing pharmacists out there.
None taken. It's funny how we tend to pigeonhole healthcare professionals, right? You think pharmacist, you think medications, prescriptions, maybe even the person behind the counter at the drugstore.
Exactly. Like, not necessarily the one having these deep conversations about your health journey.
Right. But who knows more about medications than a pharmacist? I mean, these are the medication experts. They understand how different drugs work, potential side effects, interactions with other meds, even how lifestyle choices can play a role.
It's true. They're like walking, talking drug encyclopedias, which honestly sounds terrifying. But this study is saying there's so much more than that. It's like they can use all that knowledge to really educate and support patients. But how does that actually translate to a better experience?
I think it boils down to feeling heard and understood. Imagine you're struggling with a chronic condition, you're probably on a bunch of different meds, and you've got all these questions and concerns.
And let's be real, you probably feel rushed at the doctor's office. Like you can't really get into all of it.
Exactly. Doctors have so much on their plates, it's just the nature of the healthcare system these days. But with this collaborative model, the pharmacist can take the time to really unpack things with the patient, go through their medications in detail, talk about any side effects they're experiencing, and really connect the dots between their lifestyle and how they're feeling.
So it's not just about adding a few minutes to an appointment, it's about a totally different approach.
Right. It's about shifting from simply managing medications to really taking a holistic view of the patient's well-being. And I think that makes a huge difference.
Absolutely. But, it's one thing to manage the medications for the condition itself, but with something like rheumatoid arthritis, there are all these other health factors to consider too, right?
100%. And that's where having a pharmacist involved can be a game changer. For someone with rheumatoid arthritis, the pharmacist could talk to them about their increased risk of heart disease, for instance. They could discuss ways to manage that risk through lifestyle changes or even just make sure they're up to date on important vaccinations.
It's about connecting the dots. Instead of just treating the symptoms, you're looking at the whole person.
Right.
It really feels like this kind of approach could change the game for healthcare.
I think so too.
Not just for patients, but for the whole system, right?
Absolutely. I mean, think about it for a second. If we could manage chronic diseases more effectively, we're talking about potentially better outcomes for patients and maybe even just maybe lower costs in the long run, which, let's face it, is a big deal these days.
It really is. Healthcare costs are a huge burden for so many people.
Yeah.
But I think it goes beyond just the financial side of things, too.
Totally.
What about the folks who struggle to access specialized care in the first place?
Oh, for sure.
Whether it's because of where they live, long wait times to see a specialist, you name it, this model could really help bridge those gaps.
No doubt about it. Having a pharmacist who's more integrated into the care team, it's like having this accessible point of contact for patients, someone who can answer questions, provide support, and really help them navigate the ins and outs of their condition.
Exactly. It's about making healthcare more patient-centered and more equitable.
100%. Although, we got to acknowledge this study had its limitations.
Right. Every study does.
It was just one clinic, one group of patients.
Yeah.
So we definitely need to see more research, to figure out how this model would work in different settings with different chronic conditions.
It's like a starting point.
Exactly, a springboard. And it opens up all these exciting questions about the future of healthcare.
It really does. How do we reimagine the roles within healthcare? How do we break down those traditional silos and create more collaborative models of care?
It's exciting to think about, isn't it? The possibilities are pretty much endless.
They really are. And it all comes back to that question, what if? What if this type of care became the rule, not the exception? How would that change things for patients, for providers, for the system as a whole? It's definitely something to ponder. So, until next time, keep those brains buzzing. If you want to delve even deeper into this topic, we got some great resources for you in the show notes.
This has been another episode of Arthritis and You, a joint journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upas, technical producer, John Ifun, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive!